Assalamualaikum doctors. In this video I am discussing about reactive arthritis video station. So reactive arthritis, the child may be arthritis. We know the features are very important following any diarrhea, GI infections, Shigella, Salmonella, Campylobacter, and the child is unable to, they have conjunctivitis features, urethritis and arthritis P features. So these are the hints or clue they will give. First we tell the DD. Monoarthritis for DD are like reactive arthritis, transient synovitis, septic arthritis, osteomyelitis, non-accidental injury, trauma, acute exacerbation of chronic disease like sickle cell anemia, hemophilia in boys, and leukemia. Causative organisms are Salmonella, Shigella, Campylobacter, Chlamydia, which can be sexually transmitted. So what history would like to ask? Number 1, onset, course and durations, fever, weight, activity and sleep, pain, tenderness, abnormal gait, abnormal movements, any rash, eye for conjunctivitis, any redness, usually no redness, hair, face, is it preceded by gastroenteritis or upper respiratory tract infection 7 to 14 days? With what about his urine amount, color or frequency? Anyone measure his blood pressures? Any pallor, weight loss, abdominal pain, swelling in the body, bruises, any history of any trauma, any history of travel, any chronic illness, any medications he is taken, any bleeding from body orifices, any previous hospitalizations, is the family registered to the social worker. So you understand? OCD, FWSL, then pain, tenderness, abnormal gait, abnormal movement, any rash, eye for conjunctivitis, any redness, usually no redness, hair and face. Is it preceded by gastroenteritis, upper respiratory tract infection 7 to 14 days? What about his urine amount, color or frequency? Anyone measure his blood pressures, any pallor, weight loss, abdominal pain, swelling in the body, bruises, any history of trauma, any history of travel, any chronic illness, any medication he is taken, any bleeding from body orifices, any previous hospitalization, is the family registered to the social worker. So what examination we'd like to do? ABC vitals is very important, hydration status, MSK examinations for hotness, range of movement for any limitations, examination of the skin for rashes, bruises or petechiae, examination of the eye, abdominal examination for hepatosplenomegaly and lymphadenopathy and sign of NAI. So what is the management plan or investigation we are doing? First of all, the investigation after involving my senior, my consultant, there is no single test for reactive arthritis to rule out other causes. Septic screening, we do the full blood count, CRP, blood culture, if immunocompromised, other culture to TB, fastidious organisms, anaerobes and fungi. Then urine profile, urine culture, usually sterile pyuria, HLA-B27. HLA-B27, look for presence of HLA-B27. It is a genetic risk factor for reactive arthritis. Radiology, joint X-ray or ultrasound if needed according to rheumatologist advice. What is the treatment we give for reactive arthritis? It is a self-limited disease, rest, elevation of the limbs and massage. Ibuprofen is used to relieve joint pain and stiffness. Okay. Managing any severe or ongoing arthritis, usually using medications such as steroid or disease-modifying anti-rheumatic drugs, DMRD, after rheumatologist advice. No need for antibiotics and treat the underlying condition. Okay. Prognosis, most of the cases resolve. However, some extend to within 10 to 12 months and become chronic enthesis-related arthritis. Follow-up is that reassurance that it is self-limited, however, if not improved or any red flags to seek the medical advice. So what are the red flags we tell for limping or arthritis? Number 1, night pain or night sweating. Age is less than 3 years, unable to wait beer, pseudoparesis, fever, systemically unwell, lymphadenopathy, hepatosplenomegaly, multiple joint affected, symptoms lasting more than 6 weeks, child age is more than 9 years with pain, restricted hip movement. So this is reactive arthritis. Thank you.